Hey, it's Dr. Gonzo and you're watching In a Nutshell. Today I'm going to talk to you about aortic valve stenosis. So you may be asking yourself, what is aortic valve stenosis? Well, remember in one of the episodes I talked to you about the normal anatomy of the heart? And in it, I described a valve called the aortic valve, which is one of the doors through which blood passes leaving the heart. So as a point of review, I've drawn this heart that has the left ventricle, which is the chamber that pushes blood out of the heart. The aortic valve, which happens to be the door through which blood has to pass on its way out of the body to the aorta, which distributes the oxygenated blood to the rest of the body. So this is what I would call a normal aortic valve. But imagine now that you have calcium deposit, an infection, or any disease process that could affect that valve. Instead of having nice floppy valves like that, what happens to the aortic valve with aortic valve stenosis is it develops this really thick calcium cover over it, causing the valve not to open effectively. So what happens in that situation is that the heart has to work so hard to push blood out of the heart that it starts accumulating, making the heart bigger, or backing up, going to the lungs, causing a disease called congestive heart failure. So what we try to do when patients show up with aortic valve stenosis is treat them with a variety of therapies that we have to our disposal, and one of them is called an aortic valve replacement. And so what you do in that case is you remove the door and then pretty much replace it with either a metal or a tissue valve. And now, because we've restored the aperture of the aortic valve to a normal one, blood can easily flow out of the heart in this fashion. Now that's one way that we can replace the valve. We can do it through an open procedure, but we also have technologies like those that we call TAVR, which is a percutaneous catheter device that we utilize to deliver one of these valves. That is also approved for people to have the aortic valve replaced. So that is aortic valve stenosis and aortic valve therapy in a nutshell. Thanks for watching. See you in the next one.